The next item that all customers are interested in is the whole notion of being responsive to the customer's needs. And there's a few things that are involved with responsiveness, but one of the things I want to start out talking about is actually being responsive. Society is absolutely pushed and guided by time. And in fact, we really flock toward businesses who will tell us that they'll do things faster than every other business. And even personally, I'm absolutely guilty of standing in front of the microwave and think it's taking forever. And for those of you who've been around before microwaves are amazingly fast. I have to tell you too, I used to have dial-up on my computer and it took forever. And now I have had broadband for a long time, and now I think it still takes forever. So isn't that funny how we're just used to having things done fast? Now, as far as medical, dental, any kind of medical customer service, oftentimes people are frustrated because they don't know how long they're going to wait. And even if I'm waiting in a restaurant, if they don't tell me how long it's going to be, I get a little frustrated. So think about that when you have patients waiting. The psychology of waiting states a few different things. First of all, we have a natural fear of being forgotten. And many dental offices are smaller. And there's 1 or 2 dentists and there's 3 or 4 people in the waiting room, and it's different. Oftentimes in medical situations, there can be 20 people waiting in a waiting room. And I'm always sitting there wondering, do they still remember I'm here? Have they forgot about me? So as a receptionist, looking out and making eye contact with every person in the waiting room, not weirdly, but just kind of naturally, is a very good idea. Perceived unfairness makes waiting seem longer. And this is an interesting one as well, especially in, for example, the emergency room. And I've been guilty of this as well, that I'm waiting there. I've been there 2 hours. Someone comes in and brought in immediately, not working for me. They better have blood gushing from every orifice for me to think it's fair. So again, let people know if you are going to bring people in differently, depending on their wait time, have a sign up and say we're triaging people, we're bringing them in order that they arrived, in order their appointment time. Just let people know what's going on. Unoccupied time feels longer. I love looking at other people in the waiting room, but when that's done, I'd like to read something. Now, I know that I need to bring my own reading material, so I will always bring a book or a magazine. But I think it's an extra treat to find up-to-date magazines in doctors' offices. Now, I will tell you, my doctor, who I adore, has Field and Stream and Parenting magazines in his office. Not interested in either. My dentist has People, and I love reading People. It's kind of a guilty pleasure for me. So I love going to the dentist just so I can read the latest People magazine. Anxiety makes a wait seem longer. And those of you who work in dental field, absolutely this is huge. So I want to spend a minute for those of you who work in industries that people tend to be anxious in your waiting room. Dental offices in particular, there is a huge issue with so many people being fearful of going to the dentist. And I have to share with you, I did research on this because I love going to the dentist's office. I've never been remotely afraid. And when I did research on it, I realized that a lot of it has to do with my experience with dentists. I have never had a bad experience. So even if you are an amazing dental office, your patients might have had bad experiences when they were younger or at other places, and it's important for you to empathize. You might not understand it, but you need to empathize. And in a few minutes, we're going to talk about the importance of empathy. People might be embarrassed. They haven't been to the dentist so long, they're embarrassed to come in. And I have to tell you again, some of the people I am closest to are terrified of going to the dentist. And they said, now it's been so long, I'm embarrassed, I'm ashamed. Be aware that that is some of your patient's attitude. There's also the worry that the dentist or the hygienist is unsympathetic. And again, we're going to talk about empathy in a few minutes. And the difference between empathy and sympathy is sympathy, you are taking on their pain, and empathy, you're understanding it. And even if you personally don't have a fear of any kind of medical procedures or dental procedures, you need to be empathetic toward your patients. Some people have a fear that there's going to be so many things put in their mouth that they're not going to be able to breathe. So I'm going to give you tips in a little bit to help diffuse the anxiety of your patients. Another issue with psychology of waiting, if you have a patient or a client who's waiting alone, oftentimes they're more anxious than other people. Excuse me, if they have other people waiting with them. And that's kind of natural. I mean, that's kind of normal again. If I have someone to chit-chat with, I'm much more comfortable than if I'm sitting there alone.